going to be performing an IM injection on my patient. First, I'm going to verify the physician's orders and compare them to the MAR. My patient is going to be getting Haldol for severe agitation PRN, so I'm going to ensure that the patient is severely agitated and needs Haldol. First, I'm going to perform hand hygiene, put on clean gloves, and then identify my patient. Can you state your name and date of birth for me? All right, after I've identified my patient, I'm going to again check the MAR and verify the physician's orders. And then I'm going to gather my Haldol and my IM needle. I'm going to be using a 25 gauge, 1 inch needle length, and I'm going to be injecting it into 90 degrees. There are 4 sites for IM injections: deltoid, vastus lateralis, dorsogluteal, ventrogluteal, and rectus femoris. So again, my patient is getting Haldol 4 milligrams IMs every 6 hours for severe agitation. So I'm going to gather my Haldol, read the vial, and ensure that the expiration date is still valid, and then verify it with my MAR. I'm going to pop the cap and then cleanse the top with an alcohol swab. Okay, and on hand I see that I have 5 milligrams per milliliter. So the doctor needs 4 milligrams IM every 6 hours. So I'm going to be giving 0.8 milliliters of Haldol. So I'm going to draw up 0.8 milliliters of air and inject that, ensuring not to touch the base of the needle. And then I'm going to invert my vial and draw up 0.8 milliliters. Okay, and I'm going to ensure that there are 0.8 milliliters in my vial. And then I would recap this if I wasn't at the patient's bedside and label it. And then I'm going to get out all of the air bubbles and then ensure my injection site, look for any places that would be adequate. So I'm going to give this in the deltoid, and I'm going to utilize the Z-track method. And I'm going to inject this at a 90-degree angle. I'm not going to inject this into the mannequin, so I won't damage it. But I would inject this 1 milliliter per 10 seconds, and then after I inject, I would hold for 10 seconds. So I'm going to inject my needle, and when I was giving it, I aspirated it and then pushed the medication. I'm going to discard this in the sharps container, and then I'm going to take off my gloves, document the procedure, document the dosage, route, and the patient's response, and the signs and symptoms of my patient's severe agitation.